Hi, Dr. Thayer here. I'm with Aura. This is going to be our 7th visit.
Yeah.
And she comes from a long way. She's been coming in from Hawthorne, which is how far? How far is your drive in the morning?
Oh, but 45 minutes.
45 minutes, okay?
Yeah,
She's a morning person. She comes early for us. And she makes the drive and braves the drive all the way down. You've seen in the previous video that she has trigeminal neuralgia, really horrible pain in her jaw. And you can see the facial twitching and the pain in her face and all the symptoms she told us about. Since then, her son has looked up and said that maybe it's not trigeminal neuralgia, right?
Yeah.
Gotcha. But we already knew that because, you know, we're not here to treat trigeminal neuralgia. We're here to treat imbalances. Symptoms that medicine and society put on people don't really matter to us here because why? We're treating balance. And when you get balance better, the body gets better.
Yeah.
So they're looking for an answer of the name, but it doesn't really overly matter to us. She had pain in her jaw. It was difficult to eat. Symptoms of trigeminal neuralgia. She had it in the past. So we'll just go with that diagnosis right now. But no matter what, you're doing a little better.
Yes.
Gotcha. So, Aura, why don't you tell us your story? What's going on? How have you been doing over the last 7 visits?
Okay. I've been doing pretty well in the sense that I try to follow up on the procedures, like keeping good posture.
How much do we talk about that here? How much do we talk about it here?
Well, a whole lot because it has a lot to do. If you look at it, we don't look at it before, but now then consciously that, you know, the doctor brought to my attention the posture. So I have to keep it in mind constantly. It's like an everyday reminder to myself. And it's a reminder too, when I hold my head down, the pain, say, here I am.
Here I am. So anyways, we've been really focusing on posture. Last couple times we've been really harping on specifics of posture. And now she even notices when she doesn't do what she's supposed to do.
It's like you get
a reminder.
Yeah. You get like a flogging with the pain.
Yeah, so what'd she say? She goes, when I spit in the sink, what happens?
The pains come
back. So the reason it happens is because she's kind of precarious in the situation right now. She's still healing, so even the smallest thing hurts her.
Yeah.
But in the long run, her body will be healthy enough to spit in the sink. So, but right now she's being reminded of it because, you know, her body needs to be reminded. Her body's waking up. It's learning. So
yeah,
very good. I love that. So tell us about you came in for the face. You said you had trouble eating. You had all this pain all the time. How much better is that?
Well, it's plenty better, and every day. Last week I came and I had a very terrible pain in the neck, and my head was so heavy, and it's like it weary you down because like your head is too big for your whole body. And after the treatment, I just feel like that it's lift up. Everything just went like in the ear. And that pain was gone, really, and I feel very good.
We have a thing we call regression here, and so Aura doesn't know this word yet, but your body has to unwind the problem. It has to kind of go back. So we moved her terrible pain in her jaw, but then she's like, my heavy head, my shoulders hurt, and why does this hurt, Dr. Thayer? I go, because we're unwinding the problem. So as these steps, we're 7 visits in, and we're teaching her strategies, and we're adjusting her as things unfold and unwind, and she's noticing that, and at 7 visits she's doing pretty darn good.
Yeah.
Good. So let's see, a couple other symptoms you had here. The ringing in the ears.
No, I don't have it.
How long did you have that before for?
Oh, I have it for years.
Yeah.
Starting at 30-something years, I had that. About 34.
Yeah.
And I haven't had it since been coming here.
Ringing in the ears gone after all those years.
Yes.
Cool. Tired. How you feeling in the morning? How's your rest lately?
Oh, that is very good. That's plenty better. Very good.
Very good, huh?
I sleep through the night on the way to get up to go to the bathroom, and then you lie, and sometimes you find yourself, used to be finding myself not trying, can't go back to sleep, but I go right back to sleep.
So how many years did you suffer with poor sleep? I'm waking up all the time.
A lot of years. It's like a tired feeling that you get up and you're tired all the time.
Yeah. So things have changed for you a little bit, right?
Yes.
And then I guess anything else you want to add in? How has this whole experience been so far?
To me, it's been very good in the sense of the different pain. Sometimes you used to feel I used to feel a lot more pain, like in the shoulder. I still feel it, but not as intense as how I used to feel it. The pain that I call that move from one place
That's right,
to
the
the
moving.
other.
That's right.
The moving
The
pain
moving pain. I forgot about that.
would go from one side to the other, then down to the lower back, then it goes down to my feet. It stays there, then it moves back to somewhere else. It's still there, but not that intense.
Gotcha. So overall, doing better, right?
Mm-hmm.
Okay. So thank you for letting us record this. We're going to get you adjusted and keep getting you better. Okay.
Yes.
Perfect.
Okay.
Okay, Aura, go ahead and lay on the table, please.
Okay.
On your back.
My movements balances too.
I'm sorry?
You remember the balance?
Okay.
Remember when I used to be like unbalanced? Like sometime I would like walking and don't lose my balance. That is very good too. The balance on my whole body.
Okay. What have I treated on you, by the way? What have I touched on your whole body these last 7 visits?
Well, trying to adjust.
No. What have I treated? What have I adjusted? What parts of the body have I cracked?
My spine, my neck.
Any other place in your body?
Well, I can say it's the whole body. for leading on one thing, just concentrating on one, which is the spine, and my neck. It has helped the whole body.
Yeah.
Yes.
Cool.
If you look at it.
Go ahead and lay down.
I couldn't do this at first. You see, I put my feet over, and when I get up, I used to be like stumbling, and I'm not doing that anymore.
Yeah. Scoot up a little for me, Aura, please. Thank you. Perfect. Right there. Good. So what she was saying is that I've only treated her neck, but her whole body is benefiting from it. And so you get to see the adjustment I've still done. I still have not even done an atlas adjustment. This has all been conservative. Middle neck, C2, C3, C4, that's it. So in the future, we'll probably move up to the atlas, which I can't wait for, but this has really just been a conservative thing with her. So I'll let you guys watch. Good. Chin up a little bit. Good. Come on, let me have it. Good, nice. Okay. So, how do those feel, Laura, when I adjust you?
It used to be more painful at first, but not that much anymore.
Yeah.
It's like gradually, it's like, the pain is limiting itself. The adjustment is like accepting the body is accepting the edge.
Couldn't explain it better myself. That's perfect. She should be a chiropractor. Thank you guys for watching. That's Aura at 7 visits. So I'm glad you guys could watch. Take care.